Hi, my name is Dr. Akshay Jain. I'm an endocrinologist. Endocrinology is a super specialized branch of medicine that deals with the treatment of diabetes among other hormonal conditions. Today, I'd like to talk to you about a significant breakthrough in the technological advancement that we have now achieved with treating type 2 and type 1 diabetes patients. So now we have something called continuous glucose monitoring, which basically is this fantastic device that sits on the skin and checks blood sugars every 15 minutes without even drawing any blood. In Parag's case, for instance, we use this method so that we could not only reinforce what the proper diet and lifestyle changes should be, but we changed his medication regimen in such a way that he had a significant improvement in his diabetes control overall.
My name is Parag Kapasi. I am a high diabetic who had the opportunity to listen to one of Dr. Akshay Jain's talks. I started visiting him since early April of 2017, and then I decided to consult him with regards to my diabetes. We wanted to analyze and evaluate how my sugars were reacting.
Using this technique, we can understand how for each individual their blood sugars changes throughout the day.
So Dr. Jain decided to put me on a small device which would track and monitor my sugar every 15 minutes for a couple of weeks.
Parag's case, if you look at the sensor, it shows the blood sugars in a 24-hour period where the averages are quite high. This is where the normal blood sugar should be, and his blood sugars were much high, and as you can see, they are in the 300 range. His average of blood sugars was 12.6% A1C, and this number should be 7% or lower for most individuals.
Once we went through that, it enabled us to decipher my eating habits and what I was consuming and what resulted in the high blood sugars at various points of time during the day.
Within 2 months, with Parag's ongoing efforts as well as the changes with the medication based on the glucose monitoring techniques that we have discussed, we were able to cause a significant improvement in his blood sugars, and you will see that his average of blood sugars have improved now to the 100 to 150 range, and the total A1C or average of blood sugars over 3 months is now down to 7.1%, which is as close to target range as possible for Parag.
But also having taken new medication, I have been able to bring down my blood sugars from over 350 levels to close to 150 levels.
Friends, we are all very different as individuals, and hence when it comes to management of a condition like diabetes, having technologies like a continuous glucose monitor helps understand what each individual's diabetes changes are and how we can best address it with the appropriate medications as well as lifestyle changes.
Thanks to Dr. Akshay Jain and Wockhardt Hospitals.